And I'm like, why? Because if you look at the physiology, the body will just use some of the sugar and the fat because that is literally the very reason we store body fat and blood sugars, like so that we have a source of energy when we don't eat. We figured it out a long time ago when we were cavemen. If we didn't weren't able to survive a few missed meals, we wouldn't be sitting here today because we as a species would all be dead because food is intermittently available. So therefore we have evolved those things. And that's what body fat is. So if you have too much of it, let your body use it up. That's all you're doing. You're using the body fat for literally the reason that we have it. It all comes down to food. I think that's really true. And I get the same things when I talk about how important food is. You get these looks from other doctors. It's like, oh, this guy's crazy. And I think that to some extent, what it reflects is the changing sort of paradigms of medicine
Mhm.
that we're seeing. Because if you go into the 20th century, then the major diseases you're talking about, so from 1900 to about 1980, 1990, you're talking about infections, so pneumonias and diarrhea and TB and all these diseases that are infectious. I mean, even now, of course, COVID, but we developed all these great antibiotics. So penicillin and all this, and we developed HIV drugs and all this sort of stuff. And we got that really well done. But the paradigm of medicine became sort of, you come to me as a doctor or as a nurse practitioner, I give you a drug, and hey, you get better, right? You have pneumonia, I give you some kind of penicillin or something like that, you get better. And the problem is that the diseases change. So we got better at that. We got wound up with a lot of chronic diseases because we weren't dying of these, infections. So what happens is, of course, you have chronic diseases like heart disease, like diabetes, like obesity, sort of these metabolic diseases, which lead to other things. But we use the same paradigm of medicine. That is, you come to me, I give you a drug. So if you're diabetic, you come to me, I give you insulin. And the problem is that that was never the right paradigm, because the paradigm in these chronic diseases is that you have to prevent these diseases and you have to go back to the root cause, which gets us back to insulin. If you have too much insulin, you're going to gain too much weight. And that's the problem. So giving a drug is not going to help it because you got to get to the root of the problem, which winds up being a lot of food. So it's this paradigm shift that we've seen over the last sort of 20 years that a lot of doctors are missing because they're still in that mindset of, you have diabetes, you come to me, I give you a drug. You have heart disease, I give you a stent. You have, cancer, I give you chemotherapy, rather than going back and saying, well, what is it that led to this heart disease? Well, it's from the diabetes, which put him at risk, which was due to the obesity, which put him, gave him the type 2 diabetes. So let's get him to change his foods, lose weight, and therefore not get heart disease. Like, that's the paradigm we have to be in now. And there's a huge amount of resistance because there's no money in it, right? So all the drug companies and all that sort of still want to stay in this old paradigm of medicine. And so it comes down to sort of insulin, because that comes down to the weight, which is leading to a lot of these problems. And the thing about insulin is that it's a normal hormone. Okay, so it's just does a job. Okay, and the problem is that it's too much. Like, if you have too much or too little of any hormone, you're going to run into problems. If you have too much thyroid hormone, you have hyperthyroidism. You treat it, right? If you have too little thyroid hormone, you give it.